To reach the community, usually do a little advertising.
Hello, this is Amy Stevens at the Health Policy Institute of Ohio. Welcome to our Lunch and Learn webinar on health and equity in all policies, an Ohio update. I'm here in our offices at HPIO with Sarah Dorn, who will be manning the controls, and we also have two of our presenters here with us in the office today. We are going to keep everyone muted except for the presenters for the duration of the webinar, just to reduce the background noise. But we encourage you to use the chat box to send us your questions and comments as we go along, and we will have time for question and answer at the end of the webinar. So we're really excited to be able to host this webinar today, which builds from a publication that we released back in September called Beyond Medical Care. And in this publication, we looked at a variety of opportunities for advancing prevention in Ohio. So we looked at these three areas of policy opportunities, and one of those areas is nurturing cross-sector partnerships and perspectives to address the factors that impact health beyond the healthcare system. So this is the area that we're going to be focusing on today, health and equity in all policies, and hearing from folks from a variety of sectors. And health and equity in all policies, as you probably already know, is all about incorporating health and equity considerations into decision-making across different sectors and policy areas. So we've got a great lineup on the webinar today with a mix of folks from health organizations and other sectors. We're going to be hearing about transportation and justice, education, and regional planning. We're going to be hearing about some things that are happening at the state level as well as in local communities in Ohio. And we'll be hearing about some health impact assessments and some other ways that people are doing health and equities in all policies approaches. So it's a really exciting mix of initiatives that we're going to hear about today. We've done these update calls and webinars in the past, over the past few years. And I would say earlier in the evolution of this area, there was more of a focus just on health impact assessments. And now we're an evolution towards a broad approach of different ways of working across sectors and really embedding health considerations in a variety of decision-making processes. So really exciting things that we have to share today. We have with us Kate Harley from the Ohio Department of Health, Stephen Johnson-Grove from the Ohio Justice and Policy Center, Robert Jennings with the Ohio Public Health Association. We also have Troy Jackson with the AMIS Project, Marie Curry with Community Legal Aid Services in Summit County, and then we have Jim Sonhalter and Ann Stahlhaber, who are with the Cuyahoga County Planning Department and the Cuyahoga County Board of Health. These are our objectives for the webinar today. So we hope that we will all gain increased awareness of health and equity in all policies activities that are happening around the state at both the state level and the local level. We hope that this webinar really motivates you to follow up with at least one of the initiatives presented here today to learn more. And I will say that since we did want this to be a lunch and learn webinar and pack this into 1 hour, we only gave our presenters 5 minutes to present, which is a pretty tough challenge for them to be able to pack all the information into short bites. But we hope that it will pique your interest and that you will want to reach out and learn more about these projects. And then finally, we hope that you'll have at least one new insight, recommendation, or resource that you can use in your work. And we will have an evaluation survey at the end of the webinar, so please tell us how well we did on reaching these objectives. We are going to start the webinar off with Kate Harley with the Ohio Department of Health. Take it away, Kate.
Hi, everyone, and thanks to HPIO for having me. I'm with the Ohio Department of Health with the Creating Healthy Communities program, and we're a chronic disease prevention program working on healthy eating, active living, and tobacco-free work at the state level, and then also in our 23 counties around the state. And today I'm going to talk specifically about some of the work that ODH has done in partnership with the Department of Transportation and our active transportation emphasis area team. And when it comes to health and transportation, active transportation is really the perfect overlap. It's something that we're both working on separately, and so we figured we might as well work together. And this kind of collaboration, I think, is a good example of the start of Health in All Policies work. So the ability to partner on active transportation more recently came out of their Strategic Highway Safety Plan, which recommended that they add 4 new emphasis areas, one of which is special vehicles, cyclists, and pedestrians. And ODOT reached out to me at ODH to help lead this new emphasis area, and together we facilitated 3 in-person meetings with a lot of partners around the state, state agencies and local levels, from education and minority health, Department of Aging, Ohio Facility Construction Commission, and then also some of our public health partners, American Cancer Society, Ohio Public Health Association, American Academy of Pediatrics, and so on. And we looked a lot at data, a lot of bike ped data. We looked at best practices that are going on around the nation, as well as good things going on around the state in terms of infrastructure for bike ped, on-the-road training programs, data collection methods. We talked about all of that stuff, and together we developed a plan for active transportation in Ohio. And our 2 major purposes with this, with the collaboration between transportation and health, we're interested in improving the safety of active transportation, and then also increasing the number of Ohioans who are choosing active forms of transportation. So at the end of the day, we're really working to decrease injury and fatality and to increase physical activity for health. And the partnership is really based off of these goals, and they go hand in hand because the data tells us that the places where people are walking, biking, and taking the bus are also places where they're less overweight and obese, and there's less injuries and fatalities. So the concept of safety in numbers is really a great thing from the transportation perspective and also from the chronic disease prevention perspective. And in all our discussions and everything we talked about in these conversations and in developing our plan really fell into 4 main categories: education, infrastructure, policy, and data. And so this is kind of where the Health in All Policies comes up, because working with ODOT on this plan can really influence funding, it can influence policy, how we're prioritizing work, and even how we're educating. And that's a great opportunity to incorporate health and equity from the beginning. So to be a little more specific, part of the plan is policy. So we're working with them internally on different active transportation or complete streets policies. And then another one that I'm really excited about is working on including metrics related to health and equity in the transportation funding scoring process. So instead of a health impact assessment, this is kind of a way to determine important metrics that we can directly integrate into a system that's going to be impacting how transportation projects are prioritized, which ones are funded, and even how they're built. And this could even incentivize plans and projects to consider health and equity as they're developed. So right now, we're really at the beginning of this process. It's a 5-year plan. We have a lot of really great partners. Specifically with health metrics, we have started by collecting, those funding scoring metrics that already exist from the different programs. We've started looking at other plans, such as like the Connect Columbus plan, which does a really great job of incorporating metrics like this. And then together, we've also developed a pretty large survey that will go out to our local and regional transportation agencies. And one thing we're asking is, are you incorporating health and equity? And so that we can see what's going on at the local level, see if we can apply it to the state level. And then, sort of our next steps will be to compile some draft metrics and then hopefully work with some of our health-oriented folks in our active transportation team to think through these metrics and how we can apply them to some of these programs. Oh, and just a couple of quick lessons learned. I think working with ODOT, we've always worked really well together, but over the last couple of years, we've really sort of focused in on the best way for us to collaborate on active transportation, and that has made for a really, really productive collaboration and being able to sort of put that partnership into an actual plan that we're both involved in has been really interesting. And then also kind of as we move from developing the plan into implementing some of our strategies, we had almost 40 to 50 partners from around the state help us with this plan. And even though it was, it was a big process having so many people involved in the plan, it really made people eager to be involved and to have a lot of things to contribute. And so that's really been important for us. And then the last thing is there's this new newsletter that ODOT's going to be putting out about active transportation news. So if you want to receive that, you can email Julie. And then also my contact information is there if you want to speak with me more about it.
Great. Thank you, Kate. And I should mention that we will be posting these slides on the HPIO website. I'll show where those will be on the website at the end of the webinar. So you'll have all of this contact information. All right. Our next presenter is Stephen Johnson-Grove. So we are going to continue with the theme of safety. And Stephen, take it away.
Thank you. The Ohio Justice and Policy Center was part of a group of organizations that were on the advisory committee of an HIA that was led by Human Impact Partners, and probably silenced and muted is Sarah Tatinsky, who did an incredible amount of work to make this come together, along with her colleagues, Kim Gilhooly and others. The report there is linked, and so I'll be short and brief, and anything more you want to see, there's an executive summary and then the full report and a nice website landing page for the report, all there, trust, not trauma. If you can go to the next slide. So what we did is, I suppose, I haven't been part of a lot of HIAs. I'm an attorney that works in criminal justice policy, but so forgive me if this is, what everybody does in HIAs. But the way our HIA did is we did a little bit of original research, that is a survey that was definitely not scientific, not a representative sample, not, control groups and all that kind of thing. But we did do some surveys in Cincinnati and Akron. We picked two cities one city where there had been some extensive history of policing reform, and one city where there hadn't. Cincinnati had some major uprisings. For those of you that have a sense of history, there was in 2001, Cincinnati looked like what Ferguson looked like a year and a half ago or so. It was lots of upheaval, lots of protests, things burning, because of an unarmed young man, black young man, shot and killed by the police. And out of that grew some policing reform. So what we wanted to do is say, okay, so from the 2001 upheaval and then the reforms that happened, is there health impacts that we can show? So one of the things we looked at is in Cincinnati and in Akron is asked people, how many times do you get stopped by police? Now again, these were not scientifically put together samples. We just picked certain neighborhoods and certain intersections and just talked to people on the street. And you can see this first chart here. Approximately 19% of survey respondents reported being stopped or arrested once or twice a month on average. 14% once or twice a week, and 12% reported it happening once or twice a day. Now, again, even if that's not a representative sample, the fact that there's a chunk of our community, whether it's 12% or some smaller chunk, that are getting stopped by the police once or twice a day, that should arrest us, stop us in our tracks and saying, what is going on? What is the effects of that? So if you go to the next slide. Unfortunately, there's a little animation mix up here, so you can't see the two charts behind there. But the first two charts that are hidden by the top chart show what are people's trust level, because that's where we went with this report. Number one is how often are people getting stopped by police? And then number 2 is, okay, so what's your then opinion of police? And as you might imagine, the trust level, when we ask the question, do you trust the police in your community somewhat or a lot? Big disparity. Blacks said 42% of blacks said yes, a lot trusted, 70% of white. If you ask the flip question, how many of you feel afraid of the police in your community? 41% of blacks said they were afraid. Only 15% of whites said they were afraid. And what we wanted to look at is that question, that was the nexus of everything, is trust. That's why the whole title of the report is Trust, Not Trauma. Is if we measure the trust relationship between the community and the police, disaggregated by race, how does that affect health? How does that affect the health of the community? And how does that affect the health of the officers? And I think that was the unique contribution of our report, is that it's one of the, there's lots and lots, as anyone who's been paying attention to this has heard, recommendations to police since Ferguson, since New York, the killings in Cleveland and Beaver Creek, New York City, I mean, just all over the place. These are egregious examples, Baltimore, of police violence against unarmed, defenseless citizens. The question is, what can, what recommendations are there? We didn't want to come out with new recommendations, but rather tie the connection between health of community, health of officers, and policing reform. So if you go to the top slide there is that what are the you see experienced stress systems because of interactions from police. We didn't do full out PTSD analysis, but we did ask people questions that were based on the factors that health researchers use for assessing PTSD. And when we asked those questions, 59% of blacks said they'd experienced stress, the symptoms that are associated, correlated with PTSD. Go to the next one. And officers have these effects too. And this is just more of a qualitative feedback from one of the focus groups we did. You can see the quote there. This is not a job that everyone can do. You realize that not everyone should see this. It's absolutely heartbreaking. You have to put a wall around your skull to handle what you're going to see. And so the police officers, when they feel like they're an occupying force, when they are completely alienated from the community that they're policing, they eventually start to internalize health impacts. Increased suicide rates, increased alcohol abuse and substance abuse, increased symptoms of PTSD. Police officers exhibit this as much as the community does. Next slide. So we want to say, so looking at that, if that's true, that erosion of trust not only degrades public safety, but actually degrades public health and officer health, then what are practices that could rebuild safety rebuild trust between community and between the community and the police? Because if you are very intentional about rebuilding trust, you rebuild health and you actually increase public safety. Cases get solved, things get diffused before they turn into violent offenses, that kind of thing. So trust, we use trust sort of the nexus point for all of our recommendations. So you can see there, publicly recognized historical context. We thought it very important that the police verbally and frankly acknowledge that there is a history of racism in law enforcement, and that until they do that, communities of color don't trust them, that there's a deep lack of trust. And so that has to be intentional, specific, clear, not sort of mealy-mouthed, that there's a clear acknowledgement of that. Second, you can see there's a specific kind of policing reform called community-oriented and problem-oriented policing. It carries with it a whole host of practices. That's a way to rebuild trust. We looked at 4 specific practices that embody that kind of policing, as many of you have probably heard in the news: body cameras, ways of supervising police, civilian review boards. And then we had something for the Attorney General to have a state of police report, and ways that the community can be more engaged in hotspot policing, so that instead of the police taking the whole job of public safety on their shoulders, that they engage the community. Next slide. And then we also included some recommendations for public health departments and the Ohio Department of Health. Research and data collection, and making sure that disaggregated by race, that reporting is being done on where are there breakdowns and violence between community and police. Again, all the detail is at the website.
All right, thank you very much, Stephen. Our next presenter is Robert Jennings with the Ohio Public Health Association.
Good afternoon, everyone. I'm Robert Jennings with the Ohio Public Health Association, and first of all, I'd like to start by thanking HPIO for inviting me to share what we are doing at OPHA regarding health inequity in all policies. And as this first slide indicates, we are truly at a crossroads as it pertains to our nation's policies and the health of our citizens. Next slide. As we all know too well, Ohio has established itself as a permanent fixture in the bottom third of many health outcomes in our country. We all know the numbers, but what is sometimes overlooked is the fact that public health and health care alone cannot fix the problems. It takes a multidisciplinary approach across many sectors such as housing, education, transportation, thank you Caitlin, or Kate, public safety, environment, as well as the health and human services to address the systemic issues we face regarding health outcomes in our state. Next slide. The Ohio Public Health Association believes that a health and equity in all policies framework is what is needed to look at the mutual and cross-sectoral benefits of improved population health. So what is health in all policies? It's an innovative approach to creating policies that consider health. It emphasizes cross-sector collaboration to achieve common health goals, and it ensures policies have a neutral or beneficial impact on the determinants of health. Next slide. Just about a year ago, the Ohio Public Health Association formed a Health and Equities in All Policies Committee to explore ways in which we could look at internal and external policy changes to improve health. We believe that policies and programs plus decision-making processes that consider health factors equal healthy public policies. Next slide. Therefore, at OPHA, we have put together a legislative initiative proposal to incorporate health and equity in all policies into Ohio's legislative process as a way to ensure that all the state's future rules and laws would have a neutral or beneficial impact on the determinants of health. And the key elements of the legislative initiative are, we wanted to emphasize equity. So I mentioned health in all policies, but we are looking at health and equity in all policies. We want it to be structured or similar to Ohio's Common Sense Initiative, which looks at the business impact of administrative rules. We want our laws to look at the health impact. We've developed an assessment tool or a health lens, or we're in the development phase of an assessment tool or health lens. Because we are looking at a legislative initiative, it would be codified in statute and provide legislative oversight. We wanted to include a robust monitoring and evaluation process for sustainability, and of course, the cross-section stakeholder collaboration would ensure shared responsibility. Next slide. So what is the intent of the legislation? We know this is an aggressive undertaking, to say the least, but its intent is to incorporate a health lens into the legislative process. And as part of that health lens, we would like lawmakers to evaluate who specifically will be impacted by the provisions of the legislation. For example, will it have a disproportionate impact on specific neighborhoods or geographical areas? Does it exacerbate the health equity gap experienced by certain races or in underserved areas of the state? Will it have a neutral or beneficial impact on the entire population? Or are there any unintended health consequences of the proposed legislation? Next slide. I think it is important to understand here that this is not intended to be a full-blown health impact assessment on all proposed legislation, but rather what I like to call a template or a checklist to try and identify any unintended consequences and to ensure that at the very least the legislation has a neutral health impact. Next slide. So where are we now? We have a legislative champion who has been helpful in asking the tough questions and in guiding our next steps. We've been asked to look at do some case studies and get examples of what other states are doing. We're doing some literature reviews. We think it's very important that we have a return on investment study, and I know the state of Washington just shared with HPIO a return on investment study that they've conducted. I've taken a look at that, and that'll be helpful in us developing our own. We want to know what the initial cost for setting up such an oversight initiative, and then the budget considerations, who will review the laws and provide the oversight, and then what is the opposition, who is likely to oppose, and what are their arguments. Next slide.
Oops. There we go.
Okay. So what are other states doing? Here's an example of what they are doing, but I think this is the point where I'll talk about lessons learned. While other states, many states are doing some various forms of health and equity in all policies, we're all starting basically at the same spot but ending up in different places. And that's because there's no central point at which we can kind of share ideas and talk about ways in which we can get to our intended goals. So my suggestion would be that we develop a network or some kind of way in which we can all share ideas, so those of us that are starting at one spot can kind of maybe get past some of those initial concerns that we have and get right to the heart of the matter. For example, we were talking with Iowa and Utah a couple of weeks ago. They want to do something similar to Ohio, but they did not know where to start, didn't know, should it be the Legislative Services Commission or some other entity that would provide the oversight. We've kind of already walked through some of those steps, so we were kind of able to help them get over some of their initial concerns. And so with that, I'll leave it with that, and I'll be available for any questions you might have.
All right, great. Thank you, Robert.
You're welcome.
We are now going to go to Troy Jackson, who is with the Amos Project. He's going to be talking about the Preschool Promise Initiative. Take it away, Troy.
Okay, thanks for having me. We were privileged and are privileged to be working with Human Impact Partners out of Oakland, as Stephen mentioned earlier, for his health impact assessment. And we also had several other partners in the local area here in Cincinnati that participated in basically an analysis of what a significant investment in early childhood and preschool would have in terms of equity and health outcomes in our community. Interact for Health, Mercy, and Children's Hospital and Strive Partnership were some of the other partners. And we basically realized that we're facing a fork in the road in Cincinnati. We have an opportunity to expand preschool to the tune of around $15 million a year of new investment of public money. And so the research really looked at what the benefit of that would be economically and in terms of health impacts here in our community. So if you want to go to the next slide. I'm sorry, go back. So some of what we were looking in terms of goals is to conduct a study to assess health and equity of a ballot initiative that would expand access to preschool, inform the residents, voters, and media, key decision makers about the findings, and engage and empower people and communities who would be directly impacted by this policy. And in terms of the way we went about the HIA, it included a survey of some of what has gone on around the country. There's currently the RAND Corporation has just done a full landscape analysis and economic modeling. So some of those results were made available. We also looked at, HIP looked at similar projects around the country, although none had actually gone into preschool specifically. We also had 3 focus groups, one made up of parents, one of providers. I think 2 were parents actually of preschool age children that just really got into the narrative of why this matters. Next slide. And so some of the findings, I won't read all of them, but some significant ones are 20,000 more children would have access to preschool over the next decade, 2,000 more per year. There would be 500 children who, through that early intervention and early support, would not require an EIP or be in a special education track. 500 students would not be held back. Even some of the child abuse and neglect stats would be reduced by 27%. We would see a reduction in crime. The bottom line is if we are doing good intervention of high quality preschool at ages 3 and 4, it just creates a better network for the family, for the child, helps the child to make sure that that child is ready to learn. So we think this could be a huge boon to our community. Next slide. So here are some of the recommendations. Expanding access to high quality preschool to all children. And the focus of what we're looking at is those most in need. Right now, the modeling is looking at free high quality preschool for every child at 200% of poverty and below at both 4 and 3-year-old levels, and significant support towards tuition for children and families at 300% of the federal poverty line and below, which would make a huge difference in terms of access, quality seats, etc. There's also a piece in the proposal that would grow the wages of early childhood workers to more of a living wage. That's one of the challenges of having quality, is making sure the wages are there to make these good jobs where folks can sustain a living. And so it's also important to note, point 4, utilize a trauma-informed approach. And I think this relates very well to what Stephen talked about a little earlier. The discipline is looked at in terms of trauma-informed with full support services, rather than the tendency that some districts and preschools have of a zero-tolerance policy that results in suspensions and expulsions, even of preschoolers, believe it or not. We're thankful that Cincinnati Public Schools, in part because of the work of the HIA and the work on the ground, just passed a moratorium on suspensions and expulsions for any child pre-K through 3rd grade. And so we want to see that extended and grow. But we think it's a good step in the right direction. We also want to make sure that we've heard about food deserts. There are also preschool deserts. We want to make sure that some isolated neighborhoods, often minority neighborhoods, have access to quality in their community. Next slide. And you can see that we believe there's a cycle, and we all know this. We believe preschool, high quality preschool, can be a great way to throw a wrench into this cycle and create a positive circle of change rather than a negative one. And I think that might be my last slide. All right. Thanks, and I also want to just highlight Holly, who did a lot of work out of Human Impact Partners. Thank you.
All right. Thank you, Troy. Our next speaker is Marie Curry with Community Legal Aid Services in Summit County.
Hi, everyone. I am Marie from, and we are in Summit County. I'm actually a lawyer with Community Legal Aid, but a lot of my work is focused on health policy, and I am the chair of the policy committee of a coalition called the Summit Coalition for Community Health Improvement. And you can see that I have, I'm pointing you to Elizabeth Foster from the Health Department if you want more information about this, because she is a central figure in keeping us moving forward. Next slide, please. I really want to thank HPO for inviting me to be part of this. I've learned a tremendous amount from the other speakers already, and Summit County is very excited to be a part of this conversation. The work of the Health and All Policies Initiative sits with the Summit Coalition for Community Health Improvement, and that's a coalition of 30 organizations, businesses, and individuals, give or take. But the Summit County Public Health Department is our agency lead, and they provide staffing and technical assistance, and also have helped move this initiative forward for the last several years. Next slide, please. And I put this information up here because I wanted you to have a chance to see the cross-sector nature of our coalition. We have, not only do we have our 3 major hospital systems, Children's, General, and SUMA, but we also have our safety net providers. Behavioral health is at the table. Our Metropolitan Housing Authority is here, as well as AMATS, our transportation folks. The food bank is here. We have government at the table. So we really have a broad coalition, and we have we don't have many private businesses at the table, but we do have Mustard Seed Market, which is one of our locally owned grocers. So we're broad-based, and that's something that we're doing pretty well, although we can always expand in that way. I say 22 plus 11 because I think that we probably have 30 different organizations that come and go, but we've got probably 22 committed that are there almost every month at our meetings. Next slide, please. I'm excited to report that in May, our Health in All Policies resolution passed Summit County Council and Akron City Council, was introduced by the administrations in both of those government entities. So our county executive introduced that piece of legislation at County Council, and our mayor, Dan Horrigan, introduced it in City Council, and our County Health Commissioner, Donna Skoda, answered questions from County Council at their meeting, and so we're getting this is an initiative that's been supported at the highest levels in our county and city government. One of the things that we're particularly excited about is that our resolution and all along the process has been explicitly attentive to issues of equity, not just health, but health equity. And our resolution specifically calls out the goals of improving population health and health equity, and taking into account the health implications of these decisions in order to do that. So we are feeling like we have that goal of equity right at the top of the list, and explicitly describes or acknowledges the fact that equality hasn't really gotten us where we want to be in terms of health outcomes, that really we need to take an equitable approach. Next slide, please. So how did we get here? Well, this has been a long time coming. If we look back, we can go back as far as 75 years to say that that's when the relationships have been building since in our local community with respect to our health systems. I would say the recent push really got energy in 2011 when we were awarded a capacity building grant from the CDC and as part of the community transformation grant cycles. That really helped move us towards this Health in All Policies goal. In February of 2004, we had a delegation from Summit County travel to Cuba to learn about their community health programs, because their health outcomes are so, they have remarkable health outcomes. And also Kamara Phyllis-Jones, who's the current APHA president and who speaks eloquently and forcefully about racial health disparities, came to Akron and spoke as part of one of our community forums. And those two events in February 2014 also launched us to a new level. But we spent almost a year doing community engagement. And this was a really critical part of what we did. We had, I think I said over 600 voices, but it was, I think really it's nearly 600 voices, I should have said. And from that, we were able to build a list of what our community wants. What are our aspirational goals as a community? And I gave you just the highlights of those goals: to have basic needs met, to be in livable communities and inviting neighborhoods, sustainable and connected communities, with ongoing opportunities for meaningful community engagement and informed policymakers. Next slide, please. So having developed these aspirational goals and having passed our resolution at City and County Council, the question is, where are we going? And the goal is to get health at the table when decisions are being made. So we are looking to identify the paths for how to make that happen. Next slide, please. So we're at the stage of next steps. I've learned about some new resources today on this webinar, but we've also done a lot of exploring, and we've researched things going on in King County and Seattle and in California, and we've been looking at a lot of the models that are out there. So we're not adrift, but as we get to this next step of implementation, this is where we make it so that the resolution is not just a piece of paper sitting on a shelf. So we're developing a system to monitor city and county councils. When are decisions coming up that are going to impact health, that we want to make sure that our policymakers are considering the health and the equity impacts? We are looking to connect with what's already being done in our community because we recognize that we're really resource rich and coordination poor. We have great programs in Summit County, but we don't all always know what everybody else is doing very well. We are looking to identify priority areas of action so that our list of aspirational goals is dense, but we can't do all things at the first moment. And so we are identifying our priority areas where we can capture synergy and passion and the groundwork that's already been laid. We're educating policymakers in our other municipalities in the county so that they can consider taking this up as well. And we think that businesses and nonprofit organizations and agencies are also significant policymakers and impact the lives of large numbers of people in our communities. And so this we think is a approach and a strategy that can be taken beyond just in at our government levels, but also in our employers. We're looking at the successes and failures of other communities, but last and not at all least, but perhaps most, that we continue to ask community members what they want and what they need and what barriers they face. Next slide, please. So I gave you a link here. We are an in-progress kind of initiative, and right now we have a very nice white website that hasn't been relaunched yet, and so at some point it will be. But this link right here is to the community engagement report, and the reason I offer that is because it actually is kind of a step-by-step of what we did to reach all those 600 people and to get their input into what we were doing, and we ended up with a pretty diverse group of people who provided us input, diverse by age and by race, primarily those two areas. And so we're pretty excited about what we were able to accomplish there. And so I share that with you in the hopes that you can see our successes and the barriers that we faced in that effort. I think that's everything I have.
All right, great. And is there a place where we can find a copy of the resolution?
Yes.
Can you
yes.
send me the link and I'll post the link?
That would be a great idea.
Okay, great. Thank you, Marie. All right, we're going to move along to our last two presenters from Cuyahoga County. Jim and Ann, take it away. Oh, actually, I need to switch screens.
Unmuted.
And Ann Stahlhaber from the Cuyahoga County Board of Health. Did you hear Jim?
Yes. Okay, so we're live. All right. So we have sort of a two-part presentation. I'm going to talk to you about the East Side Greenway study, and Annie will speak to you more about the accompanying health impact assessment. So next slide, please. Thank you. The East Side Greenway study itself, we applied for funding. We were accompanied by Land Studio, local public art nonprofit. Oh, a little fast there. Thank you.
And the health impact assessment was funded through the Pew Charitable Trust, and the grant was actually awarded to the Cleveland City Planning Commission, who is our partner, and this HIA was the work of the Cuyahoga County Board of Health.
Next slide, please. And the County Planning Commission applied to NOACA, the Northeast Ohio Area-Wide Coordinating Agency. They're a local municipal planning organization that distributes state and federal transportation funds. So they have a program called Transportation for Livable Communities Initiative. So county planning applied on behalf of 14 communities, which is basically the northeast quadrant of Cuyahoga County. And we partnered with Land Studio. Again, they're a public art agency who are in charge of coordinating the entire process. We started with a budget of $150,000. It grew a little bit with some local match.
And the HIA was kind of unique in that it was, if you could go back just a sec.
Okay.
The HIA was actually funded separately from the TLCI grant and planning process, but we did want to coordinate our efforts, and so what we did was the HIA was funded and actually conducted prior to the development of the East Side Greenway TLCI plan, So it was a really kind of a good example for health inequity in all policies, because the health impacts were known prior to the actual design of the plan.
And you'll see from this graphic that this was sort of the bones of our project area, with some known greenways, existing trails, known parks, and open space, with the goal of establishing better connections. So next slide, please. Here's the entire study area. It's 20 different communities, some part of the east side of Cleveland, several first suburbs type communities, as well as some more rural exurban communities. Next slide, please.
So this slide shows an example of the existing trails. It's kind of small, so I apologize, but the green lines represent both the existing trails as well as proposed greenway connections, and the thicker lines up there are called major missing links. And so the goal is that the greenway is going to be a network of trails and greenways traversing the 20 communities included in the study, and the study was to provide recommendations for alignments, trailhead locations, and a phasing strategy for moving into design and implementation, so that there would be a unified network serving as an alternative mode of transportation, connecting neighborhoods to employment centers, transit, green space, and recreation opportunities.
And there were a lot of cross-section partnerships that were already in place, but were developed, made much stronger by this process. So in addition to the 20 different communities, we had the Cleveland Metro Parks on board, the Greater Cleveland Regional Transit Authority, the Ohio Department of Transportation, the National Park Service, the Regional Sewer District, Cleveland State University, and the Soil and Water Conservation District, along with a number of like watershed partnering groups. Next slide, please.
So the overall vision for the Eastside Greenway is that it is an interconnected system that serves the community with positive health, recreation, transportation, and economic benefits. And Jim's going to talk about the project goals for the TLCI, which included the incorporation of the HIA.
So next slide, please. Okay. This entire network is really designed to be, it's mostly an on-road system. So taking advantage of existing public rights-of-way, streets, sidewalks to identify a non-motorized network. And you'll see from a couple slides that we're going through a very diverse area, so it's important to support economic development and reinvestment, especially in underutilized and vacant and abandoned properties, because it's these latter properties that provide great opportunities for greenway development as well. Annie, you want to talk about number 3?
Yeah, so one of the great things about this project was that we did have the HIA running kind of prior to the full study, and we were able to incorporate the results into the consideration for the actual plan, which was great to see that the design company, you know, put that as one of their forefront project goals. So we can see it reflected there in number 3.
So number 4, incorporating green infrastructure was really important, because this area of the county is very highly developed. And there are a number of different wastewater treatment plants that are not part of the regional sewer district. And a lot of them are under consent decrees for correcting combined sewer overflows. So we saw these as incorporating green infrastructure as a way, as I said before, to promote green infrastructure and create more greenways, because if you're setting aside land that has to absorb stormwater, it's probably a pretty good place to put a trail facility as well. So, and we're not doing this in a vacuum. With so many different actors involved, they all came to the table with their own planning initiatives for trails, for stormwater, you name it, in addition to just general capital improvement plans. So we just wanted to get all of this on the table so that we can sift through this to see what made sense to collaborate on. Next slide, please.
So this slide shows one of the maps that was created as a result of the health impact assessment. So we looked at data for the life expectancy, which is shown in the shaded colors. So the red census tracts are those with the lowest life expectancy, and then the pink is a little bit higher, and then going to the greens and the dark greens where the life expectancy is the highest. So you can see that the Eastside Greenway traverses areas where there's a significant difference between within the same greenway where life expectancy can vary up to 20 years. And so this kind of brought the equity issue to the forefront, and it was very meaningful to take into the planning phase. And it was very interesting throughout the process of the HIA and the public meetings where we actually had the design consultants talking about equity and racial issues and prioritizing areas of need rather than opportunity areas. So it was kind of a eye-opening experience, I think, for the design consultants, and it was very interesting to hear their perspective and research and how they kind of came around with this study. Next slide. So this area is the same geographic area showing the life expectancy on the map within the Eastside Greenway, and then there's the dots there that show the data from our Department of Transportation, which is the collisions for people on cycle or walking pedestrians. So you can see lots of clusters of collisions under, for us that makes sense to us because we see like major corridors there like Euclid Avenue and St. Clair, but you don't see the street names, so you might not see that. But those clusters are actually highly trafficked areas. One thing that this map really brought to our attention was the fact that there are lots of crashes in certain areas, but one of the issues is that we didn't have user rates for knowing whether or not lots of people are walking and biking in those areas, or if it's just a lot of people are crashing because they're really unsafe or badly designed, or traffic is very congested. So that kind of triggered an issue that was one of the limitations of the health impact assessment, was that we needed to go back in our monitoring and evaluation and look at who is using the trails and greenways and also the sidewalks in those areas, and tracking the usage and comparing it with the collisions and looking at the landscape there, because some of those areas where there are lots of crashes are actually some of the most walkable and bikeable areas in the Cleveland area. So it's difficult to know if it's just a high number or that there are safety concerns there. So that went into our plan.
And based on the MetroQuest survey that we did as part of this, it was also revealed that in the green areas, a lot of those people who were walking and cycling were doing it more for recreation and exercise, whereas in the pink and red areas, people were using active transportation just because car ownership was so low and transit ridership was so high. Next slide, please. So we're knitting this all together through a couple of different ways, and as I said, most of these improvements that the Greenway study recommends would be taking place in public right-of-ways. But again, we recognize that there are opportunities to develop greenways, so these would be dedicated spaces for off-road facilities. And you can see from some of the photos, the one in the lower left, that's an old railroad right-of-way. In the center, we look at areas in riparian corridors where we have opportunities, and of course, you see a Sharrow in the next slide over. So with the Greenway access, we're really taking advantage of what individual cities and neighborhoods have to offer in terms of their parks and destinations. So it's really getting people out of their house, into the neighborhood, and into local parks. Next slide.
Right, we need you guys to wrap it up pretty quick. We have time for questions.
You got it. Bicycle infrastructure, that's very obvious for the existing public right-of-ways. So lots of different treatments, whether they're bike lanes, sharrows, or all-purpose trails. Next slide. And the types of projects, you can see there are varying levels of recommendations and different priority levels. But the most important ones would be the ones we call priority projects transformative, where we're going through some of the most impoverished areas and areas of high transit ridership to really link people to employment centers. And since you all have access to this presentation, we could probably move ahead to the next slide. And here's some specific recommendations for the health and impact assessment.
Yeah, so this was a slide that actually was used by the design group, and in their presentations showed the ways that they took the recommendations from the health impact assessment and incorporated it into their plan. You can skip ahead.
Okay. And our biggest takeaway is this is a regional plan with a huge regional impact, and the funders and participants are so impressed that we're recommended for funding to take this level of study and apply it to the rest of the county.
All
and
right.
with that, we thank you very much and happy to answer any questions.
All right, thank you. Put us back to our main presentation here. I just wanted to mention quickly that there are many other local health departments that are involved in health impact assessments. And so we just have one slide here from Columbus Public Health. And the Cincinnati Health Department has also conducted several health impact assessments, as well as the Delaware County Health Department. And if there are other examples of local health departments involved in doing this type of work, please let me know. We'd love to be able to share your work as well. So, and I want to quickly acknowledge HPIO's core funders listed here. And we do have a few minutes for questions from the audience. So please take a minute to type some questions into the chat box. And as you do that, I'm going to pull up the HPIO website so that I can show you where you can find some of the information that we've been talking about today. So if you go onto the main page of the HPIO website and then go under groups, you can go to the Wellness and Prevention Network website. And on that website, you'll see a button for cross-sector work, cross-sector partnership. And we have several resources here related to health and equity in all policies, including a fact sheet that has some just some basic information, as well as some of the examples from Ohio communities that we talked about today, and then some recommendations for how to move this work forward. So please check that out. And then we also have a repository here of HIA reports from Ohio. So we have the Eastside Greenway project that Jim and Ann were just talking about. An executive summary from that HIA is posted here. We also have the Stress on the Streets HIA report that Stephen was talking about is posted here, and then some others as well, including the Delaware County one that they did on the Outlet Mall project, and some work by Columbus Public Health and the Cincinnati Health Department. And right after this webinar, we will post the slides from the webinar today here as well. All right. Gotten any questions yet? Yes, we do actually have one for Jim and Ann, wondering about partners in your work, asking if the City of Toledo was involved in your Greenway initiative.
No, there's several counties to the west of us, so they weren't involved.
Thank you.
However, there's a new effort underway called the Green Ribbon Coalition, which is Congresswoman Capter is involved with, and it's about doing an inventory of existing trails and greenways along the Lake Erie shoreline, and so everyone from Toledo to Ashtabula is involved in that. So stay tuned.
All right, looks like there is a question here for Stephen. The question is, to what extent has your work been disseminated across the law enforcement and other entities in Ohio?
It's certainly gone out to several. We've, during the course of the HIA, we had deep engagement from Cincinnati Police Department, and there was in the middle of our HIA, we got a new police chief, so I made sure that he got the HIA. And also because of some of the police shootings in Ohio, there was a task some people may have heard of set up by the Attorney General and the Governor's office on policing reform, and I made sure they got it too. Unfortunately, what I can't say is that there's been much response. I mean, I've tried to follow up lots of times, haven't got much engagement from law enforcement as I thought I would to follow up on the specifics, because we have recommendations for specific police departments and recommendations for state level entities, and that hasn't really gotten much uptake yet here in Ohio.
You're still working on it, right?
Yeah. Unfortunately, well, regrettably, I don't have a lot of resources to continue to work on it. We've got my office has lots of other criminal justice reform projects, so this one hasn't taken off. We haven't been able to follow up a lot on it. I am sorry, I can't say much better news than that.
So I think that brings up a great point, is that something that I noticed in all of these presentations was the wide variety of decision makers that all of these initiatives are working to address. So in Stephen's case, it's police chiefs, and then other, the commission that he mentioned. Kate talked about the Ohio Department of Transportation. Robert talked about impacting legislators in Ohio, so state legislators. And then Marie talked about county and council members that were targeted decision makers. So I'm wondering if any of the presenters would like to say a word about what you've learned about communicating with these specific types of decision makers, and if there's anything maybe you would do differently, or what you learned about how to craft recommendations or other things that will really get the attention of and get some action by these different decision makers. Maybe Marie, since you had a recent win with getting those resolutions passed, could you say a word about how you were able to get the city and the county and city council members to pass the resolution?
Sure. We actually have been working on this for over a year, and our county council, our county executive's office, and our several people within the mayor's office were engaged in the process all along. So and our county health commissioner has been engaged in the process all along. So we've had pretty good buy-in all along the way at the administration level. And so when bringing it to the county council, I would say the most important piece, the most important piece was giving them information ahead of time. Some of them had been engaged in learning a little bit about the process. County council was less engaged than I think city council had been for various reasons. I think because in the county level, they really leave it to the health department to bring it to them. And so having our health commissioner be the one to bring it to them, I think gave it a lot of that, and she's a trusted member of the of our governmental entities, that made a big difference. That's probably the biggest thing. We met in advance with the county executive's office and staffers to make sure that they understood kind of all of our pieces. We had some very tight, like one-page double-sided, and that was it, with pictures, so it wasn't all text, about what health and all policies is. And I think that was really one of the biggest pieces, was developing our education packet in a way that was going to be accessible.
All right, great. Thanks, Marie. Sure. And we have a question from Mary from Summit County asking, how long do you anticipate coming up with the Health and All Policies initiatives will take? Their organization is in the process of working on something similar for the city of Cincinnati. So maybe, Marie, can you talk about how long that process took for you guys?
You mean how we got to where we are now, or what our next steps are?
I think it's a question about timeline, like how to where you got. So where you got. Yeah.
The biggest piece that I would say we started with attention and focus in March of 2014. We knew that this was going to be one of our next steps ahead of that, so we weren't starting from scratch. But that's where we really started to say, okay, what is health in all policies, and how do we get to a resolution, and what do we do with it after we get there? Was March of 2014, and so we're May of 2016. I think it could have gone faster. There are two pieces that slowed us down that we may, with better, sort of more dedicated staff, might have gone faster. One is the community engagement part of our work. That really took us 10 months to put it together and do what we wanted to try to do. If we had, and some of that just has to happen because that's relationship building out in the community. How do you reach the people that you're trying to reach? How do you go to them instead of bringing them, always saying, okay, we're going to have a gathering, everybody come and see us. But going to where they are, figuring out who the trusted community members are to reach out and say, can we come and talk to your group? Can you talk to your group? Can we sort of building those relationships? And then it took us a fair amount of time after the community engagement, after we kind of said, okay, we have all of the input that we want to do, what are we going to do with it, to synergize that information. That really took more than 6 months. And so those, I think, were the big places where we lost time. Now, I would say some places might lose more time than that, and other places might be able to put that piece together faster. So of those two, it took us 2 years, and I would say that if I were to try to do it again, I might think I could do that in a year. I don't think I could do it in 6 months.
All right, great. Thanks, Marie. So it sounds like Cincinnati is going to be trying to do something similar, and we would love to hear of other examples. If you're part of a community that's thinking about trying to get a resolution like this passed, please let us know, and we will post a link to the resolution on this page here. Any other questions popping up? No? All right, we are not seeing any other questions in the chat box. So thank you all, everyone, for participating, and check out the link to the survey in the chat box, and we will also send you an email with that survey. We always look forward to hearing feedback and suggestions for how to improve these webinars. Have a fabulous rest of your Thursday. Goodbye.